presenteeism, where you have employees who aren't healthy enough necessarily to complete their work on a full-day schedule. These activities simply can help them reduce some of their, not only increase their performance, but also reduce their economic outputs, because they're having to pay for some of these healthcare. And that's not only in the U.S., it's across the world as well. So there are certain focuses, and it's, with Continua, we're trying to look at all of those individual activities. Part of it is that as a alliance, we have to make sure that we have the product there in order to solve the need as well. And I think that's what we're headed with the alliance. But then again, it's now to start to pick out those solutions. And I'll turn it back over to the panelists to fulfill at this point and allow them into the conversation here.
I was going to just want to say that we're not pessimistic at Qualcomm about this happening. And it's a matter of when we might get frustrated with reimbursement with one factor somewhere, we find a path of least resistance and we might go to another country or another region where we can get it. So all of these technologies are happening. It's just a matter of where. And then the question is, when in this country, when is it open enough for these technologies? So they're all being developed. And there are lots of people in this room we work with and on this panel within Continua. So they're all going. It's just a matter of when do they get adopted.
Yeah, and from our perspective, I can tell you, we wouldn't be part of Continua and driving these things if we would be pessimistic about it. It is just, we try to come up with solutions, and we believe that we need interoperability, connectivity as an ingredients to actually bring better solutions into the market for diabetes and what goes beyond. I mean, the fact is we have to go beyond just what these little slices, and this is where I'm not as in short term as optimistic to get a breakthrough, but if we make steps in the right direction, that's certainly, absolutely.
We're optimistic about the promise also. Our point is simply that we need to do something in addition to or different from the way we've gone about trying to do this. Coming up with the better technology is not going to be the answer. It can help.
Yep. I think that I'd like to close the note that there are significant deployments going on. For example, the Veterans Health Administration has already deployed 42,000 individuals with telehealth solutions today and have published some studies in that sense. So there are parts of the government who are paying attention, who recognize the benefits of this activity, and internationally as well. The NHS in the UK is deploying 5,000 to 8,000 patients this year. So we are seeing some opportunities start to arise in this particular market space. So thank you very much.
Wasn't this a fantastic panel?